Hello everyone, welcome to Alpha IVF. As we know, one of the important factors that really affect the decisions in a couple seeking fertility treatment is the success rate. But what does IVF success rate really mean actually? So today we are going to get a better understanding about what does IVF success rates really means from one of our senior fertility consultants, Dr. Leong YU. So with him, we will be able to understand what is IVF success rates and what are the methods that one can do in order to improve their IVF success rates.
Today we're going to talk about what does IVF success rates mean. Hello, I'm Dr. Leong from Alpha IVF. Now, when you see your doctor pertaining IVF, there'll be various rates that the doctor will discuss. For example, pregnancy rates, implantation rates, and so on. Of course, pregnancy rates and implantation rates are very important. It's a way to gauge whether things are going to go well for you in a place where there are better pregnancy rates. But what's more important actually will be take-home baby rates. Now, for example, I'll make it very basic and simple. When we talk about pregnancy rates, it simply denotes what are the chances of the patient getting pregnant if she does IVF. So for example, if you have 50 patients doing IVF and you have all 50 patients getting pregnant, it's going to be 100%, and vice versa, for example. So although that is important, a lot of times we need to know whether this pregnancy goes on all the way to 9 months well, whether things are going to go well or not. Because most important, at the end of the day, you want to have a healthy baby in your arms at the end of 9 months of IVF, of the pregnancy. So take-home baby rates in most cases will give you a better understanding of whether the IVF and the pregnancy will go on well in a very general sense. As you know, pregnancy can occur even naturally and miscarriages can happen in the tune of about 15% in most cases. Of course, I'm not saying that if you do IVF, you're not going to have any miscarriages. You will still have miscarriages. But if you want to talk about a successful take-home baby, meaning good take-home baby rates, first thing is to minimize miscarriages. Because you can get pregnant, but if you're going to lose the pregnancy in the first 3 months, of course, it's not going to give you any good results at the end of the day. So, no doubt you can have good pregnancy rates. I'm sure all IVF centers will try their best to give you a pregnancy, but what are you doing as a patient to try to ensure that this pregnancy will go all the way to 9 months well, and therefore giving yourself a good take-home baby rate. Now we know that one of the major causes of miscarriages is because of babies or fetuses having abnormal DNA or genetic material. It's not anybody's fault. Things do happen spontaneously, even in nature. And in such cases, more often than not, embryos will not proceed themselves any further and the mother will end up with a miscarriage, generally in the first 3 months of the pregnancy. Now, with the modern advent of IVF, with PGT or PGS, we can assess the genetic makeup and the material of the embryos before transfer. Therefore, if you were to only transfer genetically normal, meaning the chromosome number, which is normal, into the womb, not only are you going to improve pregnancy rates, you will also improve take-home baby rates. Because theoretically, by putting in chromosomally normal embryos, the pregnancy should ensue with a normal fetus and therefore minimizing, I'm not saying completely zero, but minimizing miscarriages in the first trimester. Therefore, one way forward is, of course, doing PGS or PGTA for your embryos in IVF to ensure a good take-home baby rate, which is what you would want. Yes, of course, every bit helps. In order for us to get good embryos, we need to have good eggs and good sperm as well. We can only go as far or try to help as far as the sperm and eggs that we get, you know. So therefore, if you have any medical conditions, for example, diabetes or high blood pressure, or any connective tissue diseases which require treatment, a good control of those diseases prior to starting IVF would of course help in the general outcome. General health is also important. For example, if you smoke a lot or if you're a heavy drinker, you know, by trying to control those vices, smoke less, quit smoking, drink less, quit drinking, those in its own very way would help. Supplementations with various vitamins, minerals would also benefit. You know, for example, coenzyme Q10, vitamin D would be helpful for women who are trying to conceive, and hopefully will improve egg quality, not compulsory, not necessarily so, but it may help with egg quality. And men normally can take supplements high in zinc, which may help improve sperm quality.